Hey there, folks. Welcome back to another eye-opening episode. Tonight we're diving deep into the world of Big Pharma, where the stakes are high and the profits are even higher. Get ready because it's going to be a wild ride full of twists and turns. These companies are raking in billions of dollars every year, and the numbers are staggering. And guess who's footing the bill for these astronomical profits? That's right, it's us. Everyday people like you and me are the ones bearing the brunt of these costs. In the first quarter of 2024 alone, 15 major drug companies made almost $29 billion in pure profit. Yes, you heard that right. Let that sink in for a second. $29 billion in just 3 months. Meanwhile, many Americans are forced to make heartbreaking choices between buying groceries or filling their prescriptions. This isn't just about numbers, though. It's about priorities and the impact on real lives. Are these companies truly in the business of helping people, or are they more focused on lining their pockets with cash? Spoiler alert. It's starting to look a lot like the latter, and the consequences are dire. Stick around as we expose the shocking truth about Big Pharma's profit-driven practices and what it means for all of us. Let's talk about priorities, shall we? Big Pharma loves to talk a big game about caring for patients, but their actions tell a different story. Take AstraZeneca and Novo Nordisk, for example. They spent more money on rewarding their shareholders than on research and development. That's right, folks. Instead of investing in new cures and treatments, they're busy making sure their investors are happy. And how do they keep investors happy? By keeping those profits sky high, of course. It's a vicious cycle. And guess who gets caught in the middle? The patients. But it's not just these two companies. This trend is happening across the entire industry. It seems like profits always trump patients. And that, my friends, is a bitter pill to swallow. You know what really gets Big Pharma's goat? The idea of Medicare negotiating drug prices. I mean, how dare the government try to make medications affordable for seniors? That's just un-American. These companies are so desperate to protect their profits that they're suing to stop Medicare from negotiating lower prices. They claim it will stifle innovation, but let's be real, this is about one thing and one thing only: money. The 10 drugs initially selected for Medicare negotiations brought in a whopping $16.5 billion in revenue. That's a lot of dough to lose if prices become more reasonable. It's enough to make you wonder who's really calling the shots in our healthcare system. Section 4. Profiteering in a Pandemic, a Case Study. Remember the COVID-19 pandemic? It was a time of unprecedented global crisis, with people confined to their homes, cities turning into ghost towns, and a palpable sense of fear and uncertainty in the air. Yeah, we all try to forget that chapter. But it's important to remember, especially when we look at how some entities took advantage of the situation. But here's a fun fact. While we were all hunkered down, terrified of a deadly virus, Big Pharma saw dollar signs. They saw an opportunity to capitalize on the fear and urgency of the moment. They swooped in with vaccines, many of which were developed with public funding, by the way, and made a killing. Take Pfizer, for example. Their vaccine was a game changer, but it also became a massive revenue stream. They raked in over $36 billion in revenue from their COVID-19 vaccine in 2022 alone. That's an astronomical figure, especially when you consider the global economic downturn. And it wasn't just Pfizer. The entire pharmaceutical industry saw a windfall. Moderna, Johnson & Johnson, they all cashed in on the pandemic. Their vaccines were crucial in the fight against COVID-19, but the profits they made were staggering. Now, I'm not saying vaccines are bad, far from it. Vaccines have saved countless lives and are a critical tool in public health. But the way these companies exploited a global crisis for profit is downright shameful. They prioritized their bottom line over the well-being of people. It's a stark reminder that for Big Pharma, the bottom line often comes before the well-being of humanity. This case study serves as a powerful example of how profit motives can overshadow ethical considerations, even in times of global crisis. Section 5, Reclaiming Healthcare, a Call to Action. So what can we do about this mess? Well, for starters, we need to get loud. We need to make our voices heard in every corner of our communities and beyond. Talk to your friends, family and neighbours. Engage in meaningful conversations about the importance of affordable healthcare. Share this information far and wide. Use social media, community boards and local events to spread the word. Let's expose Big Pharma's greed and hold them accountable. Contact your elected officials and demand affordable healthcare for all. Write letters, make phone calls and show up at town hall meetings. Support organisations fighting for lower drug prices and a more equitable healthcare system. Volunteer your time, donate if you can, and participate in their events. This isn't just about us, folks. It's about the future of healthcare. It's about ensuring that our children and grandchildren have access to the care they need. We need a system that puts people before profits, a system where everyone has access to the medications they need. No one should have to choose between paying for medicine and other essentials. It's time to reclaim healthcare from the clutches of Big Pharma and build a system that works for all of us. Together, we can make a difference. And that's the show.